Hello, friends. It's Carla, your online doctor, with today's Live in 5. Today is Tuesday, June 23rd. It is 5 p.m. Okay, so more talk on COVID-19 because I'm getting tons of emails from all kinds of experts. Researchers at Oxford University have discovered what is believed to be the first evidence of a drug that can reduce the risk of death from COVID-19 by up to 1/3. It's basically a commonly used steroid called dexamethasone. It is readily available and affordable worldwide. Okay, I'm sure most of you think like I do. Just like with the flu, you're not afraid of getting it. You just know you're going to feel like crud. But with COVID-19, the fear of dying from it, right? I mean, if I knew I was going to get it and be laid up for a week, I'd be like, okay, get it over with, right? But it's the fear of dying from something that we really don't know much about. We're learning more and more that has us all nervous and anxious and scared, right? So this drug is readily available and worldwide. It was found to reduce deaths in patients receiving oxygen, reducing deaths by 20%, and those on ventilators by about 35%. Okay, now this is minimal, a low cost drug, but the downside is there were minimal effects on people who were less ill. Okay, but that's okay because this very inexpensive drug, if it helps the more severe cases, awesome, right? Now, these are preliminary results, but any drug shown to improve survival is just amazing. Now, since the appearance of COVID-19 roughly 6 months ago, the search has been on for treatments that can improve survival. Clearly, a cure would be the best option, but I'll take increased survival any day until we get to a cure. Now, steroid drugs are, the way they work is they reduce inflammation, which sometimes develop in COVID-19 patients as the immune system overreacts to fight the infection. Now, the World Health Organization and other experts advised against using steroids earlier in the course of an illness because that can impede the clearing of the virus. It can actually interfere with your body's ability to fight an infection. Okay, so you certainly don't want to impair your immune system. We're talking all the time about building up your immune system and making it strong, right? But you want your immune system to fight any infections. But in more severe cases, much of the problem is severe inflammation that is hurting them, the patients, more than helping them. Okay, so at that point, when the infection is probably not gone, but when you get to a point where that inflammatory response in the lungs is just making it so difficult to oxygenate the blood, that's when this drug needs to step in. So knowing when to start steroids is going to be the key. Now, as I've mentioned before, the best treatment for this virus will often be a cocktail of different drugs, including remdesivir, which is shown, and we've talked about this before, to shorten the recovery time in severely ill patients from 15 days down to 11 days. Now, that, again, doesn't sound like a huge thing, but 4 days is really a good improvement. And again, if you can add steroids to the mix and maybe shorten that even more, that would be great. So combining these two will be tried or experimented with to see if we can get even better results. Now, dexamethasone in the study was given orally if the patients were just on oxygen supplementation, and given IV if somebody was on a ventilator. Both were given for 10 days. Now, the exact dose used wasn't given yet. It will be available once the study is officially published, but the article I read said the dose was actually a low dose of dexamethasone, which is generally safe for most people. And the good news about that is they may still be able to increase the dose and maybe get more people to respond to that severe inflammation and actually improve more people. So that information will be coming hopefully in the coming weeks. Again, hopefully this is being considered by the experts and the doctors who are treating these patients, because if you're giving a low dose, not that more is always better, but it's certainly, in somebody not responding, it's probably worth a try. So that made me very optimistic. Again, the more days that go by, the more time these experts and scientists have to find more drugs to give doctors options and give patients a better chance of survival. So, on that note, here in hot, sunny Florida, I hope you guys are having an awesome day. I will see you again tomorrow for another Live in 5.